It's beginning to look a lot like cirrhosis, jaundice of the skin, from the hyperbilirubin, waste products of hemoglobin, due to lack of bile production. It's beginning to look a lot like ascites, fluid in the abdomen. From the portal hypertension, the lack of albumin, increased capillary pressure causing third spacing. The liver acts like recycling company with 4 major roles and responsibilities: detoxing ammonia and drug metabolism, storing glycogen, producing bile, coag factors, and albumin. Encephalopathy with altered LOC. Too much ammonia in the blood, a byproduct of protein metabolism. Give lactulose to aid the excretion. It's beginning to look a lot like cirrhosis. Soon we'll do a paracentesis. Drain the fluid from the abdomen, then give albumin. Bring the fluid back into the vascular spaces.
Get over 2 hours of free liver lectures at simplenursing.com. 82% or higher on your next nursing test. Guaranteed.
Guys, Michael Linares here with simplenursing.com. Right now, we're going to be talking about our liver mashup. We're going to be going into everything involving the liver: cirrhosis, portal hypertension, ascites, encephalopathy, and all the other conditions that comes with having a bad liver. So let's get into it right now. Hopefully you liked my song about the liver. I know a lot of people were requesting Elvis, but Elvis is not in the house today. I'll have a blue moon, Christmas, without you. Alright guys, so let's talk about the liver and exactly what the liver does. So there's my little liver right there. Now, I know that, in nursing school you have to remember so many different topics and you have to recall a lot of information. So it's been a little while from your pathophysiology days. So let's go into exactly what the liver exactly does, the pathophysiology of the liver. Let's do it here, guys. So I like to think of the liver as a recycling company. Recycling Incorporated. And what's our name of the recycling company? I call it PDSM. People Drink So Much Recycling Company. And I'll explain exactly what all this means right now. So, People Drink So Much Recycling Company. Just because your liver acts as a detoxifier for a lot of different things. Mainly alcohol, we hear. When people are boozing it up too much, when they drink too much, they have liver problems. And I'll explain exactly how that works. But first, guys, let's talk about what the liver does. So P stands for produce, okay? What does the liver produce? The liver produces A, B, and C. Now, if you guys are taking notes, I want you to write this down, or you guys can pick up the full lecture at simplenursing.com and take it from there. So what does the liver produce? The liver produces A, B, and C. The A stands for albumin, okay? That's what the liver makes. Now what is albumin? I like to think of albumin as Al Pacino from the movie Scarface. And if you guys haven't ever seen Scarface, it's okay, but it makes a little more sense to correlate albumin with Al Pacino. Just because albumin has really three major responsibilities. Albumin attracts fluid, attracts water into the vascular spaces. Albumin also attracts drugs. It's mainly a transporter of drugs. And it also binds heavily with calcium. So, if you have Al Pacino in the movie Scarface, Al Pacino is a famous actor, Hollywood actor, and in his role of Scarface, he is a drug lord of the drug cartel. I know it's not too family friendly, but it helps me remember at least. And he transports drugs. He also is next to Miami, so there's a big water source, so that reminds me of water. And the main drug that he transports is cocaine. I'm sorry, but it is. So that reminds me of calcium, because calcium is usually white. And so if you remember that albumin transports drugs, attracts water, and binds heavily to calcium, that white hard substance, calcium, then you'll remember that that's what albumin, Al Pacino, does, okay? The next thing, what does the liver produce? Bile. Now, what does bile do? I want you guys to think of bile as a bus, okay? So think of bile as a little bile bus. Now, that is a horrible bus, but I want you guys to think of bile as a bile bus. Now, what is a bile bus consist of? Bile really just transports bilirubin. Bilirubin is just a breakdown of old hemoglobin, those old red blood cells. And the red blood cells go to the spleen. The spleen converts those red blood cells into bilirubin. Then it goes back through the vascular system up into the liver and gets converted into bile there. And I call bile a bile bus because bile transports bilirubin and it also transports cholesterol. So when your liver makes bile, that bile is then secreted directly into the bile ducts, and that little gallbladder that we have, usually located, where's my eraser here? Let me draw it out for you. Here's our liver. So our spleen's like right here. And our gallbladder's right here. And then our small intestine is right here. Okay? So when your body breaks down food or breaks down drugs, it usually gets metabolized and sent directly into the liver to be detoxed. And I'm going to get into that next. But it gets detoxed in our filter right here. The good things get detoxed and produced into something that we can use and utilize. And that's why I call it a recycling company. Because it takes old products like our old hemoglobin, turns them into bilirubin, and then acts as a transporter, a bus, to pick up all the extra cholesterol around our body so that we're not really high cholesterol, and it flushes it out of our body in our stools. So guys, if your liver is not working correctly, your cholesterol is going to go up. Your LDLs, your HDLs are going to be off balance. Your LDLs are going to rise. Your happy cholesterols, your HDLs, are going to decrease. And guys, your total cholesterol is going to be skyrocketing above 200. So that really is not good. And that's what bile does. It takes that extra cholesterol, puts it in a bus, and transports it out of the body. Now, that is just one part of it. So our liver produces albumin, bile, and it also produces C. Now what do you think C could be? C is our coagulation factors. Now anytime I'm tutoring a new student, I ask them, what does coagulation factors, what does that mean? What does it mean to coagulate? So coagulation factors talk about blood clotting. And the main ways that we see if blood is really clotting in the body is if we have PT, PTT, or INR. These are our lab values to see if the blood is clotting in the body. In terms of your coag factors, the liver produces coagulation factors to make the blood clot. So it decreases this coagulation time. Without coag factors, you're going to be bleeding a lot more. If that makes sense. You're not going to be forming scabs. You're not going to be forming clots. So if I cut my arm right here, and I had some type of liver abnormality like cirrhosis or hepatitis, I'd be bleeding a lot and bleeding profusely because I lack this coagulation factor here. So guys, let me ask you a critical thinking question here. How would someone with liver cirrhosis, how would their labs look? If your instructor's asking you, how will your labs look for someone with cirrhosis? Well, if you remember, what does the liver do? The liver produces albumin. So if my liver is messing up, my albumin is going to be low. Messing up, my albumin is going to be low. It produces bile. So my bilirubin, because remember, that bile bus transports bilirubin and also transports cholesterol. My bilirubin is going to be skyrocketing because if the bus is broken down, if the bile bus is not working, then bilirubin has to walk to school. And how does it walk? By itself. It walks all over the body. And that's really what makes our skin turn yellow. That's what makes our skin turn jaundice. That's what we like to call it. Our total cholesterol is going to be higher than 200 because we're not having that bile scoop up all that cholesterol and transport it out of the body. Your LDLs is going to be skyrocketed above 100. Your HDLs is going to be less than 40. So your cholesterol is all going to be off because that bile is not scooping up that extra cholesterol. And your coagulation factors are going to be off. Your coag panel, your PTT, your INR are all going to be off, guys. And you have to understand that we're going to be bleeding a lot more. So that's what you guys have to understand in terms of what your liver produces. Now let's talk about what the D part means for your people drink so much in terms of your liver. So the D part, what does the second thing that the liver does? The liver detoxes, guys. Now, what does the liver detox? And I kind of mentioned it before. The liver detoxes our alcohol, right? Our ETOH. If you guys haven't heard of ETOH before, that's what medical terms talk about in terms of alcohol toxicity. So the liver acts as a detoxifier. So think about it like this. Anytime you take a drug, or anytime you drink something, alcohol, soda, whatever, it goes through your mouth, right? So we can draw a mouth right here. Into your esophagus, down into the stomach, right? And then into your small intestines. The first part being the duodenum. Because we know that the small intestine is broken down into three different things. The DJA. The duodenum, jejunum, and acetabellum, okay? So when we take something in, we're drinking our soda, we're drinking our alcohol. It goes right into the small intestine, and the body is so smart that it absorbs whatever it's coming in, and it's almost like Border Patrol. It says, hey, I don't know what's going into my body. I don't want to just immediately release it into the bloodstream. So what am I going to do? I'm going to make sure it passes customs, right? I'm going to make sure it passes inspection. I'm going to make sure that it's safe for my body to be able to, I'm going to make sure that it's safe for good transportation. It's not going to hurt my bloodstream because this blood is going to my heart, this blood is going to my brain, this blood is going all around my body. So guys, this is what is talked about in terms of the first pass phenomenon. Okay? I don't have any room here, but first pass. We can just say it's customs. Your border patrol. Your first pass phenomenon. When you drink alcohol, before it goes into your bloodstream, it must first pass through that liver, your customs, okay, your border patrol. That's what we're talking about in terms of detoxing it. So, the next time you go out for happy hour, just know that that first place that alcohol is going to hit is going to be your liver, and it's going to detox it immediately. So, those little cells inside the liver that detox it is called your comfort cells. Ew. Messy handwriting. But your comfort cells are those trash men. I call it Mr. Comfort. Mr. Comfort is the trash man that is inside the liver that says, hey, I'm going to detox you, and I'm going to make sure that everything that is going into the bloodstream is safe. That's the main reason why when we give PO medications, when you give someone a medication by mouth, let's say you're giving them a pain medication, you're giving them Norco, you're giving them Vicodin, you're giving them whatever, Percocet. It goes into the bloodstream from your mouth because it goes through your esophagus, your stomach, gets absorbed in the small intestine, and what happens next? It liquefies inside the small intestine, goes into the bloodstream, but it first passes that liver, that customs. So guys, when they say, what is the onset, what's faster, an onset of PO medication or an onset of intravenous medication? Obviously, there's no first pass phenomenon if you're giving Dilaudid or morphine in a vein, because it doesn't have to go through the liver. You're going right to the source. You're going right into the bloodstream. And so that's why it acts a lot quicker, because it doesn't have to go to the customs first. So that is what the D stands for our PDSM recycling company, or liver. Okay? So let's go into S. What does S stand for? That's right, storage. So, what does the liver store? We know that it produces A, B, and C. We know that it detoxes, it acts as that customs, that border patrol, before anything that goes into our mouth hits the bloodstream, right? But what does it store? It stores glycogen. Now, what is glycogen, right? I want you guys to think about this real quick. Whoops. Glycogen. If we had a brick wall, all right, This can be our brick wall here. If we had a brick wall, we call this a wall, right? But what are each individual bricks called? Bricks, right? So is it a wall or is it a brick? It's a wall of bricks, right? Okay, now follow me here. Glycogen is pretty much a wall of glucose. So each and every brick is called glucose. We can almost just say that, your entire 401k is an accumulation of your paychecks, right? That your 401k is that glycogen. But what is each and individual paycheck? That is a glucose. Basically, every single glucose that your body needs to store in terms of for like a rainy day, glycogen is that wall that is that storage mechanism. So if you're starving, or if you have to do a marathon, or if you have to do an Olympic game, your liver will store some glycogen for that rainy day. When you exert yourself so much, it can start peeling off some glucose to make sure that your metabolism and your body has enough energy to produce and perform. Does that make sense a little bit? Hopefully it does. So that is why a lot of marathoners will do something called carb loading. They'll eat like a ton of pasta the night before a big run. They'll eat like a lot of carbs, a lot of bread, a lot of starchy things that usually break down in glucose. But when your body senses way too much glucose, it'll first store inside the liver and store it as glycogen, that big brick wall of glucose. So that next day, when you have that fitness competition or you have whatever, your marathon, it'll start peeling off some stored energy to make sure that you are better prepared and have enough energy to complete all your activities. So that is what it stores. It stores glycogen. Cool. All right, guys, our last one, metabolism. Metabolize. So, what does your liver metabolize? Excuse me. I just did some metabolism right there. So, your metabolism. What does metabolism mean? Basically, you're just converting things. You are breaking things down for your body to use and utilize. You're metabolizing, you're detoxing, you're producing things that were waste products before, and you're converting them into something useful for your body to produce for energy. So your body metabolizes something called ammonia into urea. Now I'll show you what this exactly means right now. But let me see here. Okay, cool. So what is ammonia? Ammonium is a byproduct of protein metabolism. I like to think about it as the protein wrapper on a protein bar. So where is your protein usually digested? It's usually digested in this small intestine, okay? So if we had a protein bar here, and we can say that this is our protein bar, all right? Protein bar. And here's a big chunk taken out of our protein bar. This is our wrapper, and this is the actual bar itself. So let me ask you something. The last time you ate something that was packaged in a package, let's say if it was a Twinkie, or let's say if it was a fruit roll-up, or a what are those wonderful things called? Ho-Hos. Do you eat the entire package with the bar itself? Of course not, right? You guys have to unwrap it, throw away the wrapper, maybe even read the label before you consume it to see how many calories, how much fat you're putting on yourself, or how much protein's going in your body. And then throw it away in the trash. And you eat the actual protein itself, right? So when we take off this wrapper, the wrapper is really just a byproduct. I call this ammonia. Okay? That byproduct of the protein wrapper is ammonia. Your body will take the actual protein bar itself, or the protein itself, digest it, utilize it as building blocks, those amino acids, and build muscle out of it. Now your body will take this protein bar wrapper, ammonia, and what does it do next, right? What do you do with your protein bar wrapper? You throw it away. If you're crazy, you can probably eat it and have a bad stomachache, but usually we throw it away in the trash, right? So how does your body get rid of it? How do you throw it away in the trash in your body? Let me show you right here. It'll go straight to the liver to be metabolized, right? Does that make sense a little bit? That protein wrapper, that byproduct, ammonia, will go directly to the liver to be metabolized. So that metabolization converts that ammonia, that protein wrapper, into urea. Urea is then excreted by your kidneys as urine. If that makes sense. The only reason why we call it urine is because it comes from urea, that byproduct of ammonia. So it goes through our liver right here, gets metabolized, and then shoots out the other end as urea into the bloodstream, and then goes to our renal artery and gets transported into the kidney, into those glomeruli to get filtered and to be pushed out to your ureters, then down into our bladder, then finally out through our urethra as urine. And that is really what the last stage of the liver does. It converts that protein bar wrapper, that ammonia, into urea, or urine. So guys, let's wrap up exactly all the major functions of the liver before we get into things that can go wrong with the liver in terms of cirrhosis, that I like to call sclerosis, which is really just scarring of the liver, before we get to go into hepatitis, before we go into portal hypertension, and before we go into encephalopathy. So let's do this. Alright guys, so we learned that the liver is really just a recycling company. PDSM Recycling Company. People drink so much. That's the way you can remember it for your test. What does it produce? It produces albumin. Albumin, Al Pacino, remember? Attracts that water. Transports those drugs. It also produces, it attracts calcium. So without albumin, you're not going to be transporting drugs, so you're going to have less onset of a drug that you give for someone with liver problems. It's not going to be transporting water, or attracting water, so you're going to have water escaping out of the vascular spaces into third spaces. Third spaces just meaning outside of the vascular area, into connective tissue, into cavities, abdominal cavities. That's where we get our ascites. Huge abdomen, just fluid in there, because we don't have that magnet, that albumin, attracting that water into the vascular spaces. Our bile is going to go down, all right? We're going to have increased bilirubin. We're going to be yellow. We're going to be jaundice. We're going to have higher cholesterol. Coag factors are not going to be producing. So we're going to be bleeding a lot more. Our PT, our PTT, our INR, our coagulation panel is going to be elevated because we're not bringing it down with those coagulation factors. We're not going to be detoxing as well. So when we drink alcohol, our liver is not going to be detoxing with those comfort cells. Mr. Comfort, those detox trash men inside our liver, not going to be working correctly. Storage. The liver stores glycogen. Glycogen is just that brick wall of glucose that we peel off for a rainy day. So we won't be able to store glycogen. For your metabolism, you're not going to convert that ammonia into urea. That ammonia now is going to be circulating throughout the blood. And those protein wrappers, that trash, is going to be circulating throughout the blood. So imagine your body having so much trash all over the bloodstream. Imagine just having so much trash in your water supply when you turn on the faucet at home. It's not going to be good. So this is the main leading cause of something called encephalopathy. Just the toxification of the brain. This is what causes patients to go ultra level of consciousness, acting erratic. That's why the doctor will usually ask for, did we draw the ammonia? Did we check to see if this patient who is acting crazy, who is acting erratic, acting altered, ultra level of consciousness, did we check the ammonia? Because that is usually a cause of altered LOC. So if we did check the ammonia and the ammonia is high, we're going to look directly toward the liver and start checking our ALTs, start checking our ASTs, specific enzymes that the liver produces. I'm going to go into that in our next lecture right now. But guys, you have to understand what the liver does, the pathophysiology behind the liver, and really to get a big understanding of it all. So guys, let's go into exactly what happens when the liver breaks down.